Joe, I do think you will have a new board member joining us tonight for the first time.
Okay.
Hopefully she's not shy. So for anyone who's joining us who is not a board member or a staff member of the Mental Health Board, if you would not mind signing in the chat, and if you're affiliated with an agency, add that information. That helps us a whole lot with developing the minutes from the meetings.
Oh, I'm trying to get a video up so I can at least say hi. Hello.
Did you do the things she claimed she did?
So it's 5:46. We have a quorum here.
I don't think so. Well, I don't know. I can't see everybody on the same. Oh, here comes the new board member. That will give you a quorum.
Probably the smallest. Okay, we do have a quorum, so we'll go ahead and start. So then, Molly, you made us to a quorum. So at some point, Molly, you introduce yourself if you would, and get to know you a little better. Just a little. Okay. So we have a quorum. Go ahead, call to order. It's a roll call.
Matt Hausman,
Here.
Daphne Maurer, Alexa McCoy, Molly McClay,
Here.
Elaine Palencia,
Here.
Kyle Patterson, Jane Sprandel,
She just stepped out. So she's here.
Jane. I thought I saw her earlier.
Yeah, she's here. She said she was going to step out to get something fixed, so that she'll be back.
John Paul Joachim, Joe Omosagie.
Yeah. The approval of the agenda.
Oh, let me catch up and share the screen here. So, hey, Joe, the other thing to share with y'all is that I'm at the Shields Carter room in order to ensure compliance with the emergency revisions of the Open Meetings Act. And Mr. Bryson is also here. He's by the doors in case anyone should come to give public input. And the doors are all locked so he can let them in. So anyway, here's the agenda. I'm sorry that I didn't mention that before.
Just a clarification for, but what you just sent out a little while ago, Lynn, that is only for the funding memorandum, right?
It's exactly. I'll show that on the screen a little bit later. All it does is make the motions a little bit more clear, and that will be posted as addendum to the packet, but I have it on a separate screen. I could probably show you both, but yes, that's exactly right.
Okay.
That's what we'll use when we go through it, just to make sure that everything is clear. Thank you.
Sounds good. In that case, I'll go ahead and approve the agenda, or move to approve the agenda.
Roll call for that.
Is there a second?
I'll go ahead and second. Can I
Okay.
second? Yeah.
Matt Hausman,
Yes.
Molly McLeay,
Yes.
Elaine Palencia,
Yes.
Jane Sprandel,
We didn't hear you, Jane. She gave a thumbs up.
I- Jane,
Jane,
Can you hear me now? Okay.
yeah.
It said that I was using my computer, but I guess I wasn't. So yes, please.
Joe Omosage.
Yes. Okay. So we have a citizen input or participation right now. Anybody? In the building or on the call? There's no one on the call or in the bio shields or at the building, then we'll move on. So my comments would be, I mean, right now we're living in a time of lots of trauma. And, yesterday from Texas, a week and a half ago in Buffalo, New York, and seems that almost every day or every week we have something like this happening. It's traumatic to the families, but it's traumatic to the nation. It's traumatic to the community. I don't know what to do personally, but I know as a group we can do something to help make our nation the nation that we all think and hope it could be. Gun-violence has gone up in our communities, and gun violence is going up nationally. Solving gun violence would be something that we as a nation can do, and that we as a community can work on and work towards. And I hope at some point we as also the mental health board can have that conversation about what we can do to effectively keep moving.
You ready for my comments?
Go ahead.
You have so much work to do tonight that I think I will defer my comments. There, maybe during discussion, if you invite me to make a comment during the meeting, I will do it. With the chair's indulgence, I wonder if it would be okay to introduce a new board member and ask her if she wants to announce herself and say hi. This is her first meeting, being appointed just 4 days ago or 5 days ago, right?
Go ahead, Molly.
Sure. Hi there, everyone. I'm Molly McClay. Can you all still hear me? I just changed my devices and my headphones are going in and out in a weird way. Yes, I was just appointed to the board. I'm really excited. I've been a social worker in the community for over a decade. I'm also a PhD student in social work at WashU in St. Louis. So all of my work is currently and has been in Champaign, Urbana. And really excited to be a part of this. Not going to lie, I'm a little bit overwhelmed with the fact that this is my first meeting and there's so much to do. And I'm going to do my best to, maybe listen and learn a lot, and definitely want to hear from all of our community partners and the community and figure out, how I can make a contribution to this board and be in part of the really, really, really important work. It's definitely a great honor to be appointed, and I'm really excited, in case you couldn't tell from the other times I said I was excited.
Thank you, Molly. Okay, and we'll get to know you as we get into the meetings and have those conversations. So let's approve the minutes from 4/20/20 and 4/27.
I will make a motion to approve the minutes from 4/20 and 4/27 if no one has any discussion.
I'll second the motion.
Thank you, roll call.
Elaine Valencia,
Yes.
Jane Sprandal,
Yes.
John Paul Joachim,
Yes.
Matt Hausman,
Yes.
Molly McClay,
Yes.
Joe Omosagie.
Yes. So we have a vendor invoice list. Expenditures. I like this new list, looks way better.
Took me a minute to get to turn it, because you can only turn it one direction. Kind of wild there.
It's good.
If there is no conversation, I make a motion to approve the vendor invoice list as presented.
Roll call. Kyle is here.
Joe, did you second that?
Oh, yeah, I seconded it, yes.
Okay. Jane Sprandal,
Yes.
John Paul Joachim,
Yes.
Matt Hausman,
Yes.
Molly McClay,
Yes.
Elaine Valencia,
Yes.
Joe Omosagie,
Yes. Kyle Patterson is here also.
Kyle Patterson.
Yes.
Now, the new business recommendations. Oh, is that a hand up?
No, this is the,
Oh,
this
hold on.
is-
Someone has a hand up, but it doesn't have a name attached. Who's 217-898? Is that a inadvertent hand or is it?
Is
that
is it possibly Dr. Maurer?
probably? Yeah, which is in a car.
Oh, okay, all right.
Hi, yes, I'm sorry. Yes, it's me. Hi.
Hi. Okay, we just wanted to be sure that. So we got you.
Sorry I'm late, and I didn't mean to raise my hand.
Okay, no, not a problem. You're in your car, so be careful. Okay. Go ahead.
Well, so this is the big business for today. This is the memo as it appears in the board packet. No content is changed, but what I learned just a couple hours ago was that the way I have written the motions for you, it's quite a ways down. So, you know, I've made suggested motions. You don't have to word them this way. You don't have to even make these motions. You can make different ones. My goodness, it's pretty far down in the document. When it gets to the new agency proposals, here they are. These motions do not indicate how much money, and that's really important. So I'm going to stop sharing now. There was also another mistake that I found before that, and that was in the grand totals at the bottom. So I'm going to stop sharing that, and I'm going to start sharing. I made a copy of this with revisions so that you can make the motions more easily because they have numbers and they're highlighted in yellow, and that will be posted as addendum. Here it is. That'll be posted as an addendum to this packet so that everyone will have it. I also put it in the chat so that everyone on this meeting has access to it right now. But anyway, the first motion is not one of those. So, anyway. So do you want any background on this? I think there's somebody waiting to get into the meeting and I have to go, there they are, okay. So do you want any more context for this?
Go ahead. Your context, please.
This is, you all discussed this this memo last week, the changes that I made from last week, like, so your study session on May 18th, then I went into the office after that and I changed some of the recommendations to align more closely with your discussion. And I also updated where there were some requirements for a particular agency. If they've already met that requirement, I took it out. So, you know, there have been some more requirements met since I did this. I wanted to get it out to you as quickly as possible. I think it went out the next day. So as of May 19th, this was current. The only changes that you're going to see in this document are where I've highlighted so to make the motion more clear. And then in the grand total in the bottom. Okay.
Thank you. And then we had a pretty good conversation about this last week. Does anybody see anything here that they would like to change or add, or do we just go ahead and make a motion for that?
Want me to put it back on the screen?
I'll go ahead and move to authorize the executive director to conduct contract negotiations as specified in this memorandum.
I'll second it.
So. Okay.
John Paul Joachim,
Yes.
Matt Hausman,
Yes.
Daphne Maurer,
Yes.
Molly McClay,
Yes.
Elaine Valencia,
Yes.
Kyle Patterson,
Yes.
Jane Sprandel,
Yes.
Joe Omosage.
Yes. Move to the next one.
Okay. And this is, as we talked about last week, this is also standard each year. It just, we ask for approval of this process each year. This is the worst case scenario, but, and we talked about, you know, it did happen after 2008, our 2009 revenues went down. I mean, the projections are really good for next year, but I don't know. Lots of talk about that economy right now. So anyway.
In spite of what's happened, people are still spending and people are still buying, so we might still do the same stuff. So.
I'll make a motion to authorize the executive director to implement contract maximum reductions as described in this memorandum.
I'll second.
Matt Hausman,
Yes.
Daphne Maurer,
Yes.
Molly McClay,
Yes.
Elaine Valencia,
Yes.
Kyle Patterson,
Yes.
Jane Sprandel,
Yes.
John Paul Joachim,
Yes.
Joe Omosage.
Yes.
I know this is kind of the boring stuff. This, once again, this is special language added 2 years ago, and we think it's continues to be relevant, even though changes have slowed down in the last year.
I move to include in all contracts the COVID-19 provision described in this memorandum.
Thanks. I like that one.
Are you seconding it? Joe?
I'll second that.
Any conversation or discussion about that? I think because I like it, doesn't mean everybody does. So,
Daphne Maurer,
Yes.
Molly McClay,
Yes.
Elaine Valencia,
Yes.
Kyle Patterson,
Yes.
Jane Sprandal,
Yes.
John Paul Joachim,
Yes.
Van Houseman,
Yes.
Joe Omosage.
yes.
All right, this is the last of the boilerplate provision or special language. And as we discussed last week, this is new. This was recommended by the attorney who helped us with the revisions to funding requirements and guidelines. The spirit of this is that the contract language can supersede the funding requirements, giving you the authority to make exceptions where you see fit. And lo and behold, not, the CPA firms are starting to raise their prices, which may require some revisions particular to a contract. So it becomes relevant all of a sudden, anyway.
I make a motion to include in all contracts the provision referencing specific exceptions to funding requirements and guidelines as described in this memorandum.
I'll second the motion.
Discussion.
Elaine Valencia,
Yes.
Kyle Patterson,
Yes.
Jane Sprandal,
Yes.
John Paul Joachim,
Yes.
Van Houseman,
Yes.
Daphne Maurer,
Yes.
Molly McClay,
Yes.
Joe Omosage.
Yes.
Now the fun begins. This is the important stuff. So you can see the yellow highlight is language that I added to the motion to help it be more accurate.
Any further discussion about the RPC?
I'll move to approve the CCMHB funding of $54,281 per year and offer a 2-year term as recommended for CCRPC Community Services Homeless Services System Coordination, subject to the caveats as presented in the memorandum.
I second the motion.
John Paul Joachim,
Yes.
Van Houseman,
Yes.
Daphne Maurer,
Yes.
Molly McClay,
Yes.
Elaine Valencia,
Yes.
Kyle Patterson,
Yes.
Jane Sprandal,
Yes.
Joe Omosage.
Yes. You at home.
Hey, Lynn, really quick question about a lot of the special provisions just in general. Have these already been communicated to the agencies?
They have, well, they have seen this memo. They've seen these special provisions a couple of times. We've not reached out to folks directly about some of these. In some cases, they've seen them and told us that they're already doing these things. And in this case, that is happening. Well, this first one. This one, they've already told us about their participation in those two entities. That's the Continuum of Service Providers to the Homeless and the CIT Steering Committee. And they have also written to us about partnering with other organizations. These things, we have not talked to them about. So this is where if we had a contract negotiation and could not come to agreeable terms, I might come back to you for a subsequent decision. But if we needed to, if we needed to have a contract negotiation with them, for example, to negotiate around those special provisions, we could do that and then get back to you if the negotiation failed.
Okay. Yeah, it was more just in general, if there are any of those things where the special provisions, if there's been any concerns raised by the agencies from these special, if you could let us know as we go through these.
Okay. Yeah, I think that's a great topic, actually. Okay.
Thanks for the clarification. Good question there.
So with that, I'll go ahead and move to approve Champaign County Mental Health Board funding of $256,700 as recommended for See You at Home Shelter Case Management Program, subject to the caveats as presented in this memorandum.
I'll second them.
Matt Hausman,
Yes.
Daphne Maurer,
Yes.
Molly McClay,
Yes.
Elaine Valencia,
Yes.
Kyle Patterson,
Yes.
Jane Sprandal,
Yes.
John Paul Joachim,
Yes.
Joe Omo Sage.
Yes.
So these are special provisions that the current contract with Head Start is not a 2-year contract, but the other ones are, these two are in the current contract with Head Start. This last one is a request from the DD board. Since a part of this is DD funding, they are interested in learning about what technology training or special assistance can be provided, not just to clients that they serve, but also to their staff. So it's a request for occasional information.
I'll move to approve the CCMHB funding of $347,235 per year and offer a 2-year term as recommended by the Champaign County Head Start, or as recommended for Champaign County Head Start and early Head Start, early childhood mental health systems, subject to the caveats as presented in the memorandum.
I'll second that.
Second.
Jane Sprandal,
Yes.
John Paul Joachim,
Yes.
Matt Hausman,
Yes.
Daphne Maurer,
Yes.
Molly McClay,
Yes.
Elaine Valencia,
Yes.
Kyle Patterson,
Yes.
Joe Omo Sage.
Yes.
So I apologize, I have not been sharing that We have asked if people would be willing to take 2-year contracts, and some have not wanted to. So far, the homeless system, I think they said, yes, they would agree to a 2-year contract if offered by the mental health board. I can't remember if Head Start did, but I think so. And in this case, they also agreed if the mental health board offered a 2-year term, they would accept that.
I make a motion to approve the CCMHB funding of $71,500 per year and offer a 2-year term as recommended for Champaign County Healthcare Consumers Disability Application Services, subject to the caveats as presented in this memorandum.
I'll second that motion and just say this is an incredible program. So
Helps a lot.
You ready?
Yes.
John Paul Joachim,
yes.
Matt Hausman,
Yes.
Daphne Maurer,
Yes.
Molly McClay,
Yes.
Elaine Valencia,
yes,
Kyle Patterson,
yes,
Jane Sprandal,
Yes.
Joe Mosaglia.
Yes.
Do not despair. Everything starts with a C.
Mhm.
We are making progress.
Any questions about this?
I'll move to approve the CCMHB funding of $127,000 per year and offer a 2-year term as recommended for Courage Connection, subject to the caveats as presented in this memorandum.
I will second the motion.
Do we want to do the other motion? Okay.
I think probably one at a time, and I have to stop sharing the screen when you do the roll call. So we'll go back to that one.
So roll call, please.
Matt Hausman,
Yes.
Daphne Maurer,
Yes.
Molly McClay,
Yes.
Elaine Valencia,
Yes,
Kyle Patterson,
yes,
Jane Sprandal,
Yes.
John Paul Joachim,
Yes.
Joe Mosaglia.
Yes.
Here's the second motion.
Any questions about this motion?
Can you just go over that again, Lynn? Why is it a matching funding?
There, I think you know what, it's in the program summary, but it's not here. The agency uses this as match for 2 other grants. And I thought that there was a representative from the agency. If it's okay for them to speak at this, but maybe they could clarify that for us, but that requires specific approval from you for these funds to be used as local match. I believe it's 2 different grants.
Do we have someone from Courage Connection that can speak to this?
I think Laura Lindsay is here.
Yeah.
There she is.
Yeah, I am, it's Laura Lindsay from Courage Connection. We specifically use it as a match for our state funding, for our local funding. If that's what you're asking, I think that's what you're asking.
Right. I think there were 2 grants referenced in the application, and I can certainly look it up. Do you?
I
remember?
believe it's ETH and SHP. It's our IDHS grants to the state.
Okay. Thank you.
Okay, thank you. Does that clarify?
Yep, yep. Just wanted to make sure everything is clear. Thank you.
Stephanie, just a roll call.
I don't have a motion.
Oh, yeah. Motion to approve these funds as match for other funding as described in the proposal.
I'll second that.
Daphne Maurer,
Yes.
Molly McClay,
Yes.
Elaine Valencia,
Yes.
Kyle Patterson,
Yes.
Jane Sprandal,
Yes.
John Paul Yoakim,
Yes.
Matt Hausman,
Yes.
Joe Omosage.
Yes.
Now, in this case and the previous, I'm not sure that they've already said if they would be willing to take a 2-year term. We'll find out.
Pat's here. I don't know if you can speak to it.
Do you need an answer to that now? I wasn't clear.
No,
Okay, good.
Good.
because we understand that on the agency side, those can also be complicated decisions and can take a minute to make. So
Any questions about Echo? Motion to approve CCMHB funding of $127,249 per year and offer a 2-year term as recommended for Cunningham Children's Home Echo Housing Employment and Employment Support, subject to the caveats as presented in this memorandum.
I'll second that motion.
Kyle Patterson,
Yes.
Jane Sprandal,
Yes.
John Paul Yoakim,
Yes.
Matt Hausman,
Yes.
Daphne Maurer,
Yes.
Molly McClay,
Yes.
Elaine Valencia,
Yes.
Joe Omosage.
Yes.
I will move to approve CCMHB funding of $398,092 per year and offer a 2-year term as recommended for Cunningham Children's Home Families Strong Together, subject to the caveats as presented in this memorandum.
A second.
I'll second the motion.
Stephanie?
Jane Sprandal,
Yes.
John Paul Yoakim,
Yes.
Matt Hausman,
Yes.
Daphne Maurer,
Yes. Yes.
Molly McClay,
Yes.
Elaine Valencia,
Yes.
Kyle Patterson,
Yes.
Joe Omosage.
Yes.
So this is one where we have not had discussion about the second special provision. The first special provision continues. The agency has done a great job of meeting that requirement. They even put that in their applications. They don't just report it. But the second one is requesting a change in the strategy to count treatment plan clients as people who have a treatment plan, which is a shift in the strategy. We have not talked to them about that. Some other things that are, the agency is still waiting for the PY21 audit, which is supposed to be here in the next couple of days. So we've got our fingers crossed that there won't be any issues, but that is one of the prerequisites that I wish we could have scratched off the list for you tonight. But unfortunately, these are things that we still need to discuss with them.
Thank you.
I will move to approve CCMHB funding of $100,000 as recommended for Dream Big, subject to the caveats as presented in this memorandum.
I'll second the motion.
Stephanie?
John Paul Joachim,
Yes.
Matt Houseman,
Yes.
Daphne Maurer,
Yes.
Clay,
Yes.
Elaine Valencia,
Yes.
Kyle Patterson,
Yes.
Jane Sprandal,
Yes.
Joe Omosage.
Yes. Family service. Any questions or comments?
I'll make a motion to approve CCMHB's funding of $25,000 as recommended for family service of Champaign County, creative social connectivity for seniors, subject to the caveats as presented in this memorandum.
Second.
I second the motion.
Matt Houseman,
Yes.
Daphne Maurer,
Yes.
Molly McClay,
Yes.
Elaine Valencia,
Yes.
Kyle Patterson,
Yes.
Jane Sprandal,
Yes.
John Paul Joachim,
Yes.
Joe Omosage.
Yes. First one is first.
In this case, I'm happy to tell you that some of these requirements, the prerequisites are completed, and the special provisions are agreed to. And the idea of a 2-year contract would be, the agency would accept that if the mental health board offers it.
Any further discussion?
If no discussion, I make a motion to approve CCMHB funding of $95,000 per year and offer a 2-year term as recommended for first followers peer mentoring for reentry, subject to the caveats as presented in this memorandum.
So Jane, you skipped down to this one, but I think we can do that if the board is ready.
Oh, I'm sorry.
I mean, if you all are ready to do that, we'll just go back.
Yeah.
How do I do that? Okay.
Ready.
Very similar. Okay.
I'll second.
Daphne Maurer,
Yes.
Molly McClay,
Yes.
Elaine Valencia,
Yes.
Kyle Patterson,
Yes.
Jane Sprandal,
Yes.
John Paul Joachim,
Yes.
Matt Houseman,
Yes.
Joe Omosage.
Yes.
Whoops. I'm sharing my email with you instead of, sorry about that. That might be fun. Okay, sorry.
Your email.
There's too much going on my screen. Okay, here we're back, going back to the motion related to First Steps Community Reentry House.
Yep.
Okay.
I can do this one also. Motion to approve CCMHB funding of $39,500 per year and offer a 2-year term as recommended for First Followers First Steps Community Reentry House, subject to the caveats as presented in this memorandum.
I'll second that.
Elaine Valencia,
Yes.
Kyle Patterson,
yes,
Jane Sprandel,
Yes.
John Paul Joachim,
Yes.
Matt Hausman,
Yes.
Daphne Maurer,
Yes.
Molly McClay,
Yes.
Joe Omo Salguier.
Yes.
So for this one, we still have a few things to do in the pre-contract requirements, but thanks to quite a bit of discussion at the April board meeting and last week's study session, and then in the interim between our staff and the team at GROW, we've resolved a lot of this and they are aware of the special provisions. And they would be willing to accept a 2-year term if the board offers that.
Any questions about GROW, your support? Or comments? Motion to approve CCMHB funding of $129,583 per year and offer a 2-year term as recommended for GROW in Illinois, Phase 4, subject to the caveats as presented in this memorandum.
I'll second the motion.
John Paul Joachim,
Yes.
Matt Hausman,
Yes.
Daphne Maurer,
Yes.
Molly McClay,
Yes.
Elaine Valencia,
Yes.
Kyle Patterson,
yes,
Jane Sprandel,
Yes.
Joe Omo Salguier.
Yes.
I did have a couple of questions. I know that we've done a lot of discussing about Promise Healthcare. But Lynn, would you be able to kind of recap of the required prior to contract, like what has been completed for this request?
Sure. So the agency responded to, I did those program summaries, which were presented last week in the study session packet, and they responded to those program summaries in time for me to include their responses in the same packet. But I chose to leave some of their responses out because they had references to personnel. And while that is technically public information, we try to protect the the confidentiality of staff. So what this is to say is that they had submitted samples of all the revised forms. So samples of all the revised financial forms, which balance the budget and resolve discrepancies and demonstrated the agency position accurately and justified the funding request. They also, in the budget narrative and in the program plan narrative, included a statement about not supplementing Medicaid or Medicare or managed care. They also, in an effort to revise the discrepancies in the targets, they also looked back and requested to make changes to previous reports for PY 21 and 22. That's finished. They did that with Mr. Bryson, maybe last week. And then I think this is something we just talked about last week. So this would be added. The reference to pediatric residency is inaccurate. It's in the program plan narrative in the evidence of collaboration section. So if the board decides to fund this, they will go in now and put all of these changes, because all of these are to the application forms. They'll put all of those changes plus the one that came up last week into the forms. And then this is still, we're still waiting for the 2021 audit report, which they know that will not be available by June 30th, which is the deadline. They expect it to be available before September 30th. So we will hold payments during that 3-month period until the audit is available and we've had an opportunity to look at the findings. The letter of engagement apparently the CPA firm can't do the letter of engagement for 2022 until the 2021 audit is done. This is one of 3 agencies that the Mental Health Board funds that uses a different fiscal year than the others. So it gets it's tricky for us, it's tricky for them. It's hard for us to understand sometimes the audit results. We need to look at the next year audit results. So this is why we're so very interested in the results of the 2021 audit, because they will answer questions about the 2020 audit. So that we've also talked about this collaboration with the Christian Health Center. They did build that into their proposed revisions too. And today I made an introduction by email between the agencies. And then this is a special provision that really is more helpful to us. It's really an informational one. It's how their financial statements need to look for the audit. It's standard for those agencies which use the different fiscal year. Does that cover everything, Jane? There was an awful lot of discussion at the study session and also during previous meetings. So I apologize if I've missed something.
No, I appreciate that update.
Any other questions or comments? If not, motion to approve CCMHB funding of $350,117 as recommended for Promise Healthcare Mental Health Services at Promise, subject to the caveats as presented in this memorandum.
I'll second it.
Van Housman,
Yes.
Daphne Maurer,
Yes.
Molly McClay,
Yes.
Elaine Valencia,
Yes.
Kyle Patterson,
Yes.
Jane Sprandel,
Yes.
John Paul Yoakim,
Yes.
Joe Omosagie.
Yes.
So for the second application from Promise, Jane's question is relevant to this one as well. Same answer, but with this program, there appears to be an issue with some vacancies that weren't filled for a long time. So we have been, in addition to all those other things that they've corrected and are working on with our team, we've had some discussions with them about excess revenue, which might be due back to the mental health board related to those vacancies. It's not related to low service utilization. Everybody had problems with service utilization during the early months of the pandemic, but this is where like we also see quite a bit of, the workforce shortage has an impact on these grants too. And so we're still working with the agency to figure that out, but otherwise, same answer. And in this one, we're also interested in them collaborating with Champaign County healthcare consumers because there is some overlap in the type of service that's provided. And you've probably seen that special provision in a few of the other ones, like collaborate with other providers of similar services. So anyway, that's the update. If I've missed anything that's important to you, I'd be happy to address it. I think we have representatives from Promise here as well.
Does anybody have questions?
I'll make a motion to approve CCMHB funding of $107,987 as recommended for Promise Healthcare Wellness, subject to the caveats as presented in this memorandum.
I'll second that motion.
Daphne Maurer,
Yes.
Molly McClay,
Yes.
Elaine Valencia,
Yes.
Kyle Patterson,
Yes.
Jane Sprandel,
Yes.
John Paul Guakim,
Yes.
Matt Hausman,
Yes.
Joe Omosake.
Yes.
So for the Rosecrans set of applications, this is one where the agency responded quite early on to the question of whether they'd be open to 2-year terms. They are not. So I had time to take that out of the recommendations. I do think we're still waiting for the letter of engagement for PY22 audit. These are existing, well, sort of existing special provisions, except for the language related to specifically to SOAR is added. And we think case managers do better when they share information with each other.
I'll make a motion to approve CCMHB funding of $80,595 as recommended for Rosecrans Central Illinois benefits case management, subject to the caveats as presented in this memorandum.
I'll second that motion.
Elaine Valencia,
Yes.
Kyle Patterson,
Yes.
Jane Sprandel,
Yes.
John Paul Guakim,
Yes.
Matt Hausman,
Yes.
Daphne Maurer,
Yes.
Joe Omosake.
Yes.
Oh, I missed Molly McClay, sorry.
Yes.
Getting close to the end of the alphabet.
Mhm. Criminal justice.
In this case, you can see me sort of softening a recommendation that we introduced in the program summary, it just recognizing that the agency doesn't have all this data, that some of these data have to come from the sheriff's office. So it's important to me if we can get these data to tell the story of how the system is working. But, you know, this is not entirely on the agency. So I can help. I can, you know, if they need me to help get the information from the sheriff's office, I can certainly do that. But it would be good to have. And I think Matt Hausman asked for an additional outcome, and they did respond to that. The only thing that he had mentioned that they can't account for is recidivism, because again, that's information with the sheriff's office that they don't always have good access to, but they did list all the supports that they would be able to track, and they do.
All right, with that, Lynn, I'll go ahead and move to approve CCMHB funding of $320,000 as recommended for Rosecrans Central Illinois Criminal Justice PSC, subject to the caveats as presented in this memorandum.
I will second that.
Kyle Patterson,
Yes.
Jane Sprandall,
Yes.
John Paul Joachim,
Yes.
Matt Hausman,
Yes.
Daphne Maurer,
Yes.
Molly McClay,
Yes.
Elaine Palencia,
Yes.
Joe Omosage,
Yes. For response.
So although this is not a new program, the program currently is operating through this Regional Planning Commission. So it's a new agency operating the same set of services. So I did add here for them to do a mid-year progress report to y'all in the winter.
Well, I will move to approve the CCMHB funding of $207,948 as recommended for Rosecrans Central Illinois Crisis Co-Response Team, subject to the caveats as presented in the memorandum.
I'll second the motion.
John Paul Joachim,
Yes.
Matt Hausman,
Yes.
Daphne Maurer,
Yes.
Molly McClay,
Yes.
Elaine Palencia,
Yes.
Kyle Patterson,
Yes.
Jane Sprandall,
Yes.
Joe Omosage,
Yes.
So here's the point in the memo where my motion writing skills begin to fail really hard. So this one is really complicated, but hopefully I got the spirit of the board discussions and earlier concerns, even from last year.
Questions or comments about why it's going to be deferred?
And you might have a better way to word this if you do agree with this.
Any questions or comments? Or change of motion?
I mean, I think my comment is, I want to make sure we're spending money on things that we know are effective. And I'm not fully convinced that I know this program is effective. And so I kind of want to see the money used in some other way towards this issue.
I think the money is there, but again, if there is a way in which you provide services in which we know, at least the research shows, it works within the community for young people, and definitely it's worth asking for.
So with that being said, I'll move to deny the request as presented and defer a decision on an alternative proposal for CCMHB funding for Rosecrans Central Illinois Prevention Services.
I'll second that. Second.
Kyle Patterson,
Yes.
Jane Sprandal,
Yes.
John Paul Joachim,
Yes.
Matt Hausman,
Yes.
Daphne Maurer,
Yes.
Molly McClay,
Yes.
Elaine Palencia,
Yes.
Joe Omosagie,
Yes. Public health.
All of these special provisions are carried over from the current contract. But the agency has asked not to do two-year contracts so that one of these special provisions will disappear. We won't use it in the contract because they'll only take a one-year term if you do offer that.
I make a motion to approve CCMHB funding of $100,000 as recommended for Rosecrans Central Illinois Recovery Home, subject to the caveats as presented in this memorandum.
I'll second it.
Oh, I'll second it.
Oh,
Matt Hausman,
Yes.
Daphne Maurer,
Yes.
Molly McClay,
Yes.
Elaine Palencia,
Yes.
Kyle Patterson,
Yes.
Jane Sprandal,
Yes.
John Paul Joachim,
Yes.
Joe Omosagie.
Yes.
so here's one where we have many discussions with the director of this program. He's great to work with. We haven't figured out all these details yet, but this is the provision related to being on a different fiscal year than others, but the agency is in the process of shifting. So at some point, this language will come out of contracts with them, but we don't know if it's time this year. So this is an issue. We may need to have a contract negotiation meeting with them just to figure out some of these details. Because it's a very, very small new agency, they have had a little bit of difficulty recruiting new board members in order to be fully compliant with the rules. So at this point, we will just work with them on a written plan, since they've made a lot of progress, but not all the way there. And then that's also mentioned here, corrective action plan for board composition. We're also, because the audit is on a different timeline, we're not sure, and if they change their fiscal year, we're not sure what to expect. Like, will they do a half-year audit to catch up? So a lot of this is unresolved, but we do feel confident that we can work with this agency toward these answers. There was also to make sure that we have some kind of backup plan for the agency in case this agency is not able to provide services to people who are still requiring them. And that might, it might be that we need to help them network a little bit with other organizations, because they are trying to help one of their current clients find housing. So I have confidence that these things will be resolved, but today, some of them are not. Just, I thought I better tell you. So,
Thank you.
Follow up, Lynn, because it sounded like the backup plan was dealing more with other providers. Are they looking at all at other staff?
oh, that's a great idea. I haven't talked to them about that because I thought potentially the best thing is to have an agreement with another agency.
True. Yeah, I agree, but just making sure we have as many options as possible for them.
Right, right. And that could be like the program could grow, for next year.
Mhm.
Okay.
Okay, I'll move to approve CCMHB funding of 61,000 as recommended for Terrapin Station Sober Living NFP Recovery Home, subject to the caveats as presented in this memorandum.
I'll second that motion.
James Randall,
Yes.
John Paul Joachim,
Yes.
Matt Hausman,
Yes.
Daphne Maurer,
Yes.
Molly McClay,
Yes.
Elaine Valencia,
Yes.
Kyle Patterson,
Yes.
Joe Omosage.
Yes.
Okay, so we're back to motions that I don't know how to write. And I think we talked about it last year too. If the motion is to deny the funding, is it clear then that you're all approving a denial? So this could be better, I apologize. Slow learner, I think.
Can we do a move to deny for all three of them at once?
There are 4.
I meant because are there 4? I thought there were 3 for thriving.
I'm not sure.
Oh, I guess there are 4. I'm sorry.
We have some parliamentarians on this meeting who could tell us how to do that.
Well, I am not a polished parliamentarian, but I think because it's regarding money, I think we have to do it separate, but that's just my 2 cents.
Okay, that's fine. Probably could have done it in the time we just had this conversation. So I'll move to deny CCMHB funding for Thriving Families Project JDC.
I'll second the motion.
Sorry about that. John Paul Joachim,
Yes.
Matt Hausman,
Yes.
Daphne Maurer,
Yes.
Molly McClay,
Yes.
Elaine Valencia,
Yes.
Kyle Patterson,
Yes.
James Randall,
Yes.
Joe Omosage.
Yes.
And then I'll move the motion to deny CCMHB funding for Thriving Families, the Garden Hills Project.
I'll second.
Matt Hausman,
Yes.
Daphne Maurer,
Yes.
Molly McClay,
Yes.
Elaine Valencia,
Yes.
Kyle Patterson,
Yes.
James Randall,
Yes.
John Paul Joachim,
Yes.
Joe Omosage.
Yes.
And then I'll move to deny CCMHB funding for Thriving Families, Thriving Community.
I'll second.
James Randall,
Yes.
John Paul Joachim,
Yes.
Matt Hausman,
Yes.
Daphne Maurer,
Yes.
Molly McClay,
Yes.
Elaine Valencia,
Yes.
Kyle Patterson,
Yes.
Joe Omosage,
Yes.
And I do want to say that, I really applaud Thriving Families for what they're trying to do. And I hope in the future they're able to accomplish these goals. It's just seems like a very daunting task. And I think with the funding, it would be not tenable to do at this time with the funding that's being requested. So yeah, for that reason, I'm going to move to motion to deny CCMHB funding for Thriving Families, Thriving CU.
I'll second it. And yes, supporting what John has said, yes.
Elaine Valencia,
Yes.
Kyle Patterson,
Yes.
Jane Sprandall,
Yes.
John Paul Joachim,
Yes.
Matt Hausman,
Yes.
Daphne Maurer,
Yes.
Molly McClay,
Yes.
Joe Omosage,
Yes.
So in this case, we've got, the agency is ready to do these things and, pending the board's decision. And then also they have already worked on the consumer outcomes. So they're a little bit ahead of the special provision. And this is an existing special provision, the one about collaborating with the coalition and youth centers.
I'll move to approve CCMHB funding of $100,000 as recommended for the Well Experience Well Family Care Program, subject to the caveats as presented in the memorandum.
I'll second it.
Jane Sprandall,
Yes.
John Paul Joachim,
Yes.
Matt Hausman,
Yes.
Daphne Maurer,
Yes.
Molly McClay,
Yes.
Elaine Valencia,
Yes.
Kyle Patterson,
Yes.
Joe Omosage.
Yes.
So in this case, I think these are also existing special provisions, nothing new. And we haven't talked to them about this stuff yet. We have asked for the letter of engagement. I don't think they've sent it yet. But these requirements remain to be discussed.
Motion to approve CCMHB funding of $93,283 as recommended for WIN recovery, entry, and recovery home, subject to the caveats as presented in the memorandum.
I'll second the motion.
Matt Hausman,
Yes.
Daphne Maurer,
Yes.
Molly McClay,
Yes.
Elaine Valencia,
Yes.
Kyle Patterson,
Yes.
Jane Sprandall,
Yes.
John Paul Joachim,
Yes.
Joe Omosage.
Yes.
So that is the end of the most important decisions that you make all year. But I wanted to also show you that the error that I found. So the errors in the motions were discovered by Stephanie Howard Gallo. This is the error that I found. I had failed to update these totals after the discussion last week. So I'll fix that in the final version of this just tells us about the approved allocations approved as of today. So that's it for that business. Congratulations, everybody. You did it.
I just had a random technical question. If for some reason there's an issue with having sufficient funds for funding programs, what ends up happening in those instances?
Well, that provision allows for cuts across the board, and I think you and I have discussed that many times over the last few years. That is absolutely possible. In some ways, it's the most fair approach, but we try to avoid that because we have some programs that are of such wildly different scale that the impact on a small program will be really destructive, where on a larger program, they might be able to absorb it. So when we did this in 2009, we started with the agencies asking what they could cut. This meant some people got laid off. So like a whole position drops out, and then you can reduce the contract by the full amount related to that salary. So that, I mean, that's just as painful, but maybe, preserves some of the integrity of the programs overall. So the other thing is that you can spend fund balance and then next year just make tougher decisions. So if we do get into a situation where the 2023 revenues do not meet this really big projection that we've got, you can catch up by funding less stuff in the second half of 2023. So those same, similar difficult decisions, but not in the middle of a contract.
Thanks, Lynn.
Follow up on that, Lynn. So how do you determine those impacts? Is that from agency input, then from their applications? I mean, is there any kind of a rubric or anything that you use, or is it kind of just?
We go to the budgets.
Yeah, of each one. Okay.
Because they're really like so much of, I think the average of where your funding is going is about 80% of the contracts go to staff costs, because these are human services delivered by humans to humans. So since those are the major costs, and there might be a program where they know someone is willing to go part-time, or they have, maybe they could seek other funding. When we lose funding, it's kind of like there's probably pain everywhere, because it would be related to an economic downturn, which means other funders would also not be, it's not like it doesn't balance usually. So we would start with the budgets. We can do some of that, quite easily from the information that's provided with the applications, but we always want to have discussions with the agencies first.
Thank you.
Any other questions or comments about potential possible 12 months from now?
Or 3 months from now.
Yeah, that too.
I mean, the only thing I wish, I know in the past we talked about like having, I know we have some buffer, obviously, but it would, I don't know why government doesn't work that way, that we can have more buffer money during the good times to save for recessions and bad times. Because we know these happen in cycles, and yeah, it's gonna be like 15 years before another one happens. If this one happens this coming year, next year, the recession. But like, I feel like this is cyclical, and like to not plan and not be able to have those reserves just sets people up for having to make difficult choices every time there's an economic downturn. And it just doesn't seem like we're planning very well, or like we're tying our hands behind our back because of the rules that we're setting up that we're not thinking about the future ramifications of. But anyways, it is what it is, but yeah.
Well, this is something, before Kyle Patterson leaves the meeting, he might have some insight into this too, but related to like the local government units fund balance policies, mental health board and the DD board set their own fund balance policy, and your policies are for at least 6 months of a full year of expenditures to be available through the fund balance. This is a lot more than most units of local government do, but there is huge variation across local government units. So we could change the fund balance policy to have more than 6 months guaranteed. I mean, that's a strategy, because because you're right, these things, here we are. It could be 2008 again, right now. So,
But isn't the worry that that biggest surplus calls attention to itself from other county units?
yes, that can
So-
start a tax objection.
Yep.
Yeah.
So,
It's a game of Jenga.
mhm. So psychology overrules logic.
Yeah, I think we have to be very clear about what is the primary purpose of this funding. What it means to have a fund balance in the face of that. I mean, you're right. People respond to financial instability with a decreased sense of wellness. And here we are.
Yeah. Political decisions aren't always the most rational, unfortunately. So I guess we have to work within the framework of that context. So I guess this is kind of the best solution where we are right now. I don't know. But yeah, I think just, yeah. I don't know. I've been doing this, 3 years now. So I just you kind of notice this cycle, and yeah, just interesting, but yeah.
Yeah, it is.
Thanks for always planning for the worst and hoping for the best. I always appreciate that.
And also the business of budget projections is so much like, it's like a combination of art and magic or something. So like the weatherman.
Especially with the economic cycles that we have within this system. Okay, let's move on to financial management coaching. Is that what we're at?
This is a fun one. And Chris Wilson was on the meeting a little while ago. Maybe he's still here. He put this together for you. This is a report about where it is now. We had gotten your approval in October, entered into some contracts in November, and they started in December to work with just a few agencies. The DDB is not participating in this. Just a few of the mental health board funded agencies to kind of test what kind of accounting or bookkeeping support would be helpful to smaller, newer agencies. So we got really mixed results, like very different results from the 4 organizations. They just needed different things. So he put this together. He developed a survey and asked everybody the same questions, and he's here to speak on it if you want to. But I wanted to tell you before this, I have a segue from the last piece to this piece, and that is that we have some incredible paper archives in the office maintained by Stephanie Howard Gallo. I am looking for a specific piece of information about the mental health board's revenues back in the 70s. And there's a reason that I'm looking for it. And we actually have board packets from the 70s in the office. Unfortunately, they didn't do a real good job of reporting on their revenues. So I'm not getting anywhere with the question I had, but I'm discovering such amazing things, like just, like the way that the boards did everything through committees, which is very difficult with the Open Meetings Act. I think they were having committees not in public meeting, so this is why we don't do that anymore. And then you can see the increased reliance on staff for some of that. And there's a really interesting essay that I found about the role of an executive director. I'm reading it because I believe that the pressures on public boards in the 70s were probably very similar to the pressures on them now. So I'm looking at that. But the most interesting thing was in 1977, they were involved with revising their funding requirements and guidelines, and they made 2 different efforts to help the agencies get better at accounting. First, they had offered a class in accrual accounting through a college here up to all the funded agencies. So they did that. And then they started talking about how would these agencies maybe share a full-time accountant. It was so interesting, like just the same issues that you all have been spending some time on in the last few years here. And so, this is our first we did the bookkeeping workshops every year for the last 3. We could continue to do that, but they don't seem to be as helpful to people as this one-on-one support. So anyway, just if you have any questions from this, it's sort of like the good news in the board packet, and it ends with, we're sort of looking for your input on what we could do next.
Thank you for that update. And Chris, if you're there, still there, if you want to add anything, that would be great.
So if you all choose to follow up after the meeting, just let me know by email if you have any thoughts about this. Chris and I are talking about a continuation of this effort with some changes, and we can bring you another memo in June.
Yeah, I think a lot of the small agencies really struggle with that particular accounting, because it's usually most people who start up these small agencies are not looking at that part of it right away. They're looking at, how do I provide the best service possible?
Can I tell you another really happy story?
Go ahead. I like that.
So here's the next agenda item. This is sort of the information section. This is the quarterly report from 211. And the provider of 211 to our region is PATH in Bloomington, and they have a contract with the state to expand and take on the 988, the Suicide Lifeline call service for all counties other than us, and I think Winnebago, which are served by Rosecrans through other funding. So this is, we still do 211 through PATH, but they're about to expand. And so here's my happy story. Remember the University of Illinois research team, the Community Data Clinic research team, which designed an online version of the 211 data so that everyone could access 211 data without having to do it by phone? The student who was the lead researcher on that won the U of I Campus Award for Excellence for Students this year, which is a cash prize. So even though the project, has stopped while 211 and 988 go through this transformation, he won a big cash prize. And I got pictures of us receiving his award, so I'll share them with you someday. That was a nice thing that happened last week. Anyway, so this is, this report sure got a lot nicer to look at when the new director took over there. So anyway, that's it.
Thank you. Any questions about 211 or anything like that? So questions or comments? If not, schedules. So I think for the next 2 months, we'll do one time.
And so we still really can't predict if we'll be in person or remote for June. But we're not going to talk about agency contracts in June. We're going to talk about everything else. So that'll be fun.
So agency input. If there's no one for the agency, go to the DD board.
They made allocation decisions last week. So they're on roughly the same schedule as you are.
Yep.
they have so many fewer decisions to make that they're able to do it in one meeting.
Okay, sounds good. And the staff reports, or the staff reports are embedded in the package. Any questions from what you see?
There's a lot. They were catching up from the couple months that we didn't have staff reports. I stopped sharing. I didn't know if you guys, if that's annoying or not.
Oh, it's all good.
Okay. There's quite a bit of content there, and then Chandra offered some documents related to children's mental health awareness and also the ongoing reading list. And then Chris's staff reports are year-to-date financials, which is kind of cool.
Board to board.
More of a question in here. I'm guessing no one was able to make it to the Promise board meeting yesterday. Just since we had talked last week that we want to try to get somebody there. I can't make the June one. I don't know if somebody would be able to do that, or otherwise I might be able to make it later.
Tuesday nights are really difficult. Okay. Tuesday evening. Okay. Any announcements or anything?
Trying to share the screen. It's upside down. Sorry. Whoops. Here it is. Okay. Whoa. How did I lose it? It's the last page of the board packet. So it was nice to be able to update it with a full list of board members. I don't know why I can't share it. It's the last page in your board packet. You can see it. It's a great. We updated the Promise meeting time. So Matt, thank you for bringing that up again. And added the new board members.
I guess I do have like one thing. So on the board to board thing, Lynn has also added the expo committee. So I am still participating in that. The biggest news on that is I feel a few of us are getting nervous as we see the COVID numbers rise. What will the numbers look like in October? At this time, it's still full steam ahead of a live event. But again, I think that's something that's in several of our minds of what's going to happen maybe in a few months. And again, none of us have a crystal ball. I wish we did. So as you know, that conversation goes on. If you have any thoughts, feel free to let myself know. Lynn, Kim, several of the staff, help in different ways. But I guess give us some thoughts on your feelings about live events and things like that.
Yeah, I know the vaccine is going to be submitted in mid-June for the kids 6 months to 5 years old for Pfizer. That's expected to get approval because it's 80% effective for the 3-dose series. So hopefully kids will get vaccinated. However, I don't know, in the US, there's this perception that it's not as severe for children, so a lot of parents are holding off. There is a good percentage that are giving their kids the vaccine and they really want their kids to get it. So hopefully as more people get vaccinated, they will help lower the spread. I think this will be a seasonal thing. However, you know, there is multiple antiviral medications available, IV medications and pills now. So I think with Paxlovid, which is Pfizer's medication, it's like 6 pills for 5 days, 6 pills a day for 5 days, and you have to take it within the first 5 days. There's only like 400 to 500 doses in the county. So it's really meant for people that are at risk for severe illnesses, hospitalization and death. So I think hopefully if hospitalization numbers stay low, even if numbers do go up, it won't limit people's ability to engage in social events. Hopefully that's my expectation, or my hope, but I mean, it's hard to know. We'll have to see when the school year starts if COVID spikes when kids get together again, or if things kind of hopefully like maybe peak a little and kind of calm down, but I don't know.
I think at this time they, correct me if I'm wrong, Lynn, at this time they've decided we will not have the children's room due to just potential exposure and things like that with youth attendees. Again, I think a concern is the fact that many of the individuals we're trying to spotlight these services to are potentially people who are higher risk for complications if they were to get COVID. So again, you know, John, I'm not going to make you our expert, but please feel free if you ever have any thoughts or insight to pass them along, because I'm all about doing it in person, but it also makes me nervous because these are some of our most vulnerable individuals in our community.
Thanks for mentioning that, Jen. Thanks, John. So if there are no other things, the motion to adjourn.
Sure, I'll move to adjourn.
Yes, I'll second that. See you 671 hours or something like that. That's 1 month. Take care. Have a wonderful rest of the evening.
Take care, everyone.
Bye. Stay
Bye,
safe.
everyone.